Welcome back to another Millennial Minute on Bold TV. I'm David Grasso. Today's big question: should uninsured people be covered during the pandemic regardless of their employment status? You've already heard from our guests, Hilary Levey Friedman, she's the author of Here She Is, and Isabel Brown from Turning Point USA. So we all know, ladies, the number of uninsured people has skyrocketed because of job loss. Should we consider these policies temporarily to cover people? You know, we heard Hilary say yes. We're hearing you, Isabel, and not so many words say no. Why is that? Do you think public health should trump all other concerns right now? Or do you think that once we start giving out insurance, no one's going to want to pay for it?
Well, first of all, I think the important thing to address here is that the answer is not no. The answer is resoundingly yes, regardless of where you fall on the political spectrum. I think the difference in people's approach really circulates around what the role of government should be in taking on this very, very unprecedented challenge that we're experiencing in the COVID-19 pandemic. Ultimately, our responsibility in 2020 and beyond should be looking for sustainable solutions to problems like this one. COVID-19 is not our world's first pandemic. In fact, it's not even the first pandemic within my lifetime. So we're bound to experience problems like this in the future as well. Addressing what we can do now from a sustainable solution rather than just putting in place temporary government programs that have no sustainability whatsoever is the best course of action to take.
Yeah, Hilary, we would all love to provide all our citizens with health care, right? But the cost of such programs are prohibitive. And in fact, employer-provided insurance is one of the most successful programs in American history. So you're asking for significant changes to our system, which may be even a good idea, according to some people. But it's hard to push through those type of changes, isn't it? And is it really sustainable to just have a blank check for health care?
I mean, it is really hard to push through these changes, as you say, but also once people get access to something like health insurance or any other program, they really don't want that taken away. So I agree that, if we're going to offer the public lots of different options, it's going to be extremely difficult to roll that back at a later date. So that's very important. But again, people are losing their jobs. They're hungry. I mean, there's just so many problems, but we have to take care of our citizens, if not just for them, but for everybody, because again, their health is going to impact others as well.
You know, one of the things I think that is really important, ladies, is to mutually recognize from both sides that our healthcare system is very messed up. I think we disagree on the approach to fix it. Hilary, you're seeking more government intervention, I imagine, overall. And Isabel, you're seeking less. So let's start out with you, Isabel. Why do you think government caused the problem, and what is the solution in your mind to really fixing our healthcare system to make sure that it doesn't bankrupt America?
Well, David, you really hit the nail right on the head. I think all Americans can agree we have a lot of work to do when it comes to our healthcare system and providing better options to the American people at a lower cost. I've been very fortunate to study this subject in depth through my master's degree at Georgetown University. And ultimately, I see a prevailing theme through every opportunity I have to study healthcare in the United States, being that the more government gets involved, the more messy the potential solutions could become when it comes to providing better health care for the American people. You saw that the passage of the Affordable Care Act. You saw that through overreach with the Food and Drug Administration. And what a unique opportunity in 2020 to reevaluate just how much red tape and bureaucracy we need when it comes to healthcare oversight from the federal government. Operation Warp Speed is a perfect example of rolling out a record fast speed vaccine for the COVID-19 virus and getting red tape and bureaucracy out of the way to deliver something more tangible and effective to the American people in less time at a lower cost. So ultimately, I think that's the right direction that we need to be going in. But that takes a lot of people willing to speak up and change the status quo.
So Hilary, you're going to get the last word here. I really think that a lot of people were actually grateful that Obamacare, got rid of pre-existing conditions. Millions of people got coverage. Unfortunately, people like me saw their policy prices go up. So this isn't really a clean cut thing, right? Healthcare is very complicated. It's 20% of our economy. What do you think, Hilary, we could do to really make a difference in regular American lives to make sure we're healthy but not going broke?
Well, it's a huge step forward that there is a public option and that there are the state exchanges and people are able to sign up and have some options. And then, of course, still have a private option. And so that mishmash system does make it extremely complicated, but at the same time, I don't think anybody wants one system that is going to have its own problems and its own bureaucracy and its own red tape. So my main thing is we need to make sure that everybody has access to healthcare, and that may look different for different people and in different places. But the most important thing is that nobody is being denied the right to be healthy. And so it will be very, very interesting in particular to see how the vaccine rolls out and see how the insurance questions are handled. And, it is amazing to think back to the polio vaccine and the way people were mobilized, and hopefully we'll come together in the same way to fight COVID-19.
So Hilary, I'm going to get yelled at because I'm out of time here, but quickly, so you are not for Medicare for all because you're saying you'd rather have a hybrid system. Is that correct?
Well, I think it is very hard to move to like one system, as you said, the cost, moving everyone there. And so there are ways to use what's working in the existing system and also supplement it.
I think Isabel would agree with that, wouldn't you?
I absolutely would.
And that's what this show is all about. Ladies, on that note, thank you so much for taking the time to talk to us.
Thank you.
And
thanks for having me.
Of course. And thank you for watching Bold TV. Be sure to find us on Facebook, Instagram, Twitter, Parler, LinkedIn, and whatever social media you consume on a daily basis. We'll see you soon.